And no, this is not March of 2020.
President Biden says the U.S. will not return to lockdowns as new COVID cases soar nationwide. The president today unveiled a new plan to help Americans fight the virus during the holiday season. One of those is increased support for hospital staffs all across the country, including right here in Indiana.
You saw the news conference right here on Wish TV. President Biden also announcing the federal government is buying 500 million COVID-19 tests and giving them to people for free. His administration also expanding the availability of vaccines. According to the CDC, more than 61% of vaccine-eligible Americans are fully vaccinated, and more than 60 million Americans have gotten a booster. The president delivered a warning to those that still haven't gotten their shot in the wake of the Omicron variant.
We should all be concerned about Omicron, but not panicked. If you're fully vaccinated, and especially if you got your booster shot, you are highly protected. And if you're unvaccinated, you're at a higher risk of getting severely ill from COVID-19, getting hospitalized, and even dying.
And coming up at 5:30, Darryl Forges takes a deeper dive into the Biden administration's plans. Again, that's coming up here in about a half an hour. Meanwhile, the U.S. Navy will send reinforcements to IU Methodist Hospital, a team of 20 Navy medical specialists coming to downtown Indianapolis to deal with the surge of patients. News 8's Garrett Bergquist has that part of our team coverage.
This deployment means 12 active duty military teams are now helping out at hospitals nationwide. That's in addition to National Guard assets.
That's 1,000 military doctors, nurses, and medics. We've already started moving medical teams. They've already landed in Wisconsin and Indiana this week.
The commander-in-chief this afternoon as the U.S. military answers a call for help from the heartland. IU Health says it asked FEMA for backup. An IU Health spokesperson says a 20-person Navy medical team will arrive later this week. The team will include doctors, nurses, and respiratory professionals. They'll be here for about 30 days. A military spokesperson says wherever these military teams go, they bring a huge sense of relief.
These are problem solvers, and they really do fill the hospital staff with sort of a renewed sense. And I know that will be especially meaningful, at the holidays.
State Health Department data show COVID patients occupy more than a third of Indiana's intensive care beds. Just 15% of ICU beds statewide are available for any patient use. The military already has teams in cities including Denver, Farmington, New Mexico, and Dearborn, Michigan. At IU Health Methodist Hospital, Garrett Bergquist, Wish TV, wishtv.com, and follow us on Facebook.
Garrett, thank you. Let's talk now about that rush for rapid COVID tests here in Indiana. They are the most sought after items this holiday season, and they can be very difficult to find. News 8's Camila Fernandez explains for us.
More people are looking to get a rapid test for coronavirus, but according to health officials, there's a chance you won't get your hands on one.
Because they're in such short supply, we're really trying to save them for those who are really sick.
We don't have too many testing. So we want to be sure that use it when it's really needed.
The Madison County Health Department says they're testing more than 100 people each day, and it expects numbers to remain about the same through January.
I just look for it to continue to be really busy for our testing clinic.
However, the health department says it's encouraging PCR testing ahead of Christmas, and you can get your results within 48 hours.
If you're traveling, plan ahead and come and get a PCR test. We don't have a short supply of those. We have plenty.
Vaccinations and testing are also being offered outside the Indianapolis Motor Speedway. The clinic is located from across Gate 2. Because of the shortage, Shalom Healthcare Center is offering testing by appointment only.
Unfortunately, we don't have that capacity at Shalom to have everybody get tested, walk in and get tested. We can have the capacity for the vaccine at this point, but not for testing.
The health department says even though it wants to test as many people as it possibly can,
I just am looking forward to a time when testing isn't as much of a necessity as having the vaccination clinic more full.
Camila Fernandez, Wish TV, wishtv.com, and follow us on Facebook.